Hello, I'm Dr. Mark. As a physician and journalist, I've spent years exploring the mysteries of diseases that often go unnoticed. Today, I want to shine a light on one such hidden threat that's quietly affecting thousands of people every year. Let's talk about valley fever. While it may not be a household name, its impact is growing, especially in certain parts of the United States. Many people have never even heard of it, yet it can change lives in profound ways. Unlike the flu or strep throat, valley fever is a fungal infection, not caused by a virus or bacteria. This means that traditional antibiotics won't work against it, and its symptoms can often be mistaken for more common illnesses. The culprits are two fungi, Coccidioides and Coccidioides posadaceae, microscopic organisms living in dry desert soils. These fungi thrive in arid environments, lying dormant in the earth until the right conditions set them free. When the soil is disturbed by wind, construction or farming, these fungi release tiny spores into the air. Even activities like hiking or gardening can stir up the dust, making exposure more common than you might think. These spores can travel for miles, carried by the wind across vast distances. This makes valley fever a unique public health challenge, as people can be exposed far from the original source. As we expand into desert regions and climate change alters environments, the risk of valley fever grows. More people are moving to these areas, and hotter, drier conditions mean the fungi are more likely to become airborne. The story of valley fever is about our connection to the land and the unseen risks beneath our feet. It's a reminder that our environment can shape our health in unexpected ways, and that sometimes the greatest dangers are the ones we can't see. When someone inhales these spores, the infection begins in the lungs. The body's immune system immediately goes to work, but the outcome can vary greatly from person to person. Inside the body, the spores transform into spherules, multiplying and spreading. This process can trigger a range of symptoms, from mild to severe, depending on the individual's health and immune response. Most people's immune systems fight off the infection without symptoms. In fact, many never realize they were exposed at all, and go on with their lives completely unaware. But for others, it can feel like a severe case of pneumonia or the flu. Symptoms can include fever, cough, chest pain and fatigue, sometimes lasting for weeks or even months. In rare cases, it can become much more serious. The infection can spread beyond the lungs to other parts of the body, leading to complications that require intensive medical care. Understanding valley fever is the first step to protecting ourselves. Awareness can help us take precautions, seek timely medical care, and support research for better treatments. So, what happens next after exposure? In the next segment, we'll explore how valley fever is diagnosed, treated, and what you can do to reduce your risk. The journey of valley fever starts with a single breath of dusty air, a reminder that sometimes the smallest things in our environment can have the biggest impact on our health. Subscribe, like, and share Cosmo Academia. Where is valley fever a concern? This question is more important than ever, as the disease is becoming increasingly relevant to people across the Americas and beyond. The answer lies in the arid and semi-arid regions of the Western Hemisphere, where the environment creates the perfect home for the fungus that causes valley fever. In the United States, the disease is most common in Arizona and California's Central Valley, considered the epicenters, with thousands of cases reported each year. The fungus thrives in hot, dry climates with alkaline soil, conditions that allow it to survive in the ground for long periods. When the soil is disturbed, the fungal spores become airborne, making it easy for people to inhale them. But valley fever isn't just a US problem. The fungus is also found in northern Mexico, as well as scattered dry regions throughout Central and South America, where similar environmental conditions exist. Countries such as Guatemala, Venezuela, and Argentina have reported cases, sometimes in rural communities where awareness is low and diagnosis can be delayed. With global travel on the rise, people can be exposed to valley fever in one country and develop symptoms after returning home. This means doctors everywhere need to be aware of the disease, even if they practice far from the fungus's traditional range. Climate change is a growing concern. As temperatures rise and droughts become more common, the fungus's habitat may expand into new areas, putting more people at risk. That's why mapping these regions and tracking changes in the fungus's distribution is crucial for public health officials and researchers. Knowing where valley fever lives helps doctors make accurate diagnoses, allows travelers to take precautions, and ensures communities are better prepared. The boundaries of this disease are shifting, and what was once a local concern is now a growing issue for new regions. If you live in or visit these hot zones, stay aware and informed, because understanding where this fungus lives is the first step in protecting yourself and your loved ones. How do you get valley fever? It all starts with the soil. When desert soil is disturbed by construction, farming, or dust storms, fungal spores become airborne. Anyone in an endemic area can inhale these invisible spores, not just workers or farmers. It only takes a single spore to cause infection. Valley fever is not contagious. You can't catch it from another person or pet. The real risk is breathing in contaminated dust. Rarely, infection can occur through open wounds, but this is extremely unusual. Public health officials often warn people to stay indoors during dust storms. The story of valley fever is a story of the air we breathe. Protect yourself by being mindful during high-risk conditions. Valley fever doesn't just affect people. Our pets, especially dogs, are at risk too. Dogs are more likely to get infected because they dig, sniff, and play in the dirt. In places like Arizona, valley fever is a common diagnosis in veterinary clinics. Symptoms in dogs include cough, fever, loss of appetite, and sometimes lameness. Most cases are mild, but some dogs need long-term treatment. Valley fever isn't contagious from pets to people or between animals. Cats and other animals can get sick too, though less commonly. If your pet shows symptoms and you live in an endemic area, see a vet promptly. Valley fever is an environmental disease, affecting all who share the same dusty air. Protect your pets as you would yourself. Subscribe, like, and share Cosmo Academia. Not everyone exposed to valley fever gets sick, but some are at higher risk. About 60% of infected people have no symptoms at all. Severe illness is more likely in older adults, especially over 60, and those with weakened immune systems. This includes people with HIV/AIDS, organ transplants, cancer, diabetes, or those on long-term steroids. Certain ethnic groups, Filipino, African, and Hispanic descent, are more prone to severe disseminated disease. Pregnant women, especially in the third trimester, are also at higher risk. For these groups, valley fever can be life-threatening. Knowing your risk is key to early diagnosis and treatment. If you're in a high-risk group and develop symptoms, seek medical attention quickly. Awareness saves lives. Valley fever symptoms can be confusing, as they often mimic the flu or pneumonia, making it difficult for both patients and doctors to recognize the illness right away. Many people may dismiss their symptoms as a common cold or seasonal bug, which can delay getting the right diagnosis and treatment. Symptoms usually appear 1 to 3 weeks after breathing in the fungus spores. These can include extreme fatigue, a persistent dry cough, fever, shortness of breath, headaches, night sweats, and joint pain. Some people also experience chest pain or muscle aches, which can add to the confusion with other respiratory illnesses. In certain cases, a distinctive rash called erythema nodosum may develop. This rash appears as red, tender bumps, most often on the shins, and can be a helpful clue for doctors trying to identify valley fever. Fatigue from valley fever can be overwhelming and may last for weeks or even months, making it hard to keep up with daily responsibilities or enjoy normal activities. The illness can seriously disrupt your daily life, causing you to miss work, school, or important events. Even simple tasks can feel exhausting. If you live in or have recently traveled to an area where valley fever is common, such as the southwestern United States, be sure to mention this to your doctor. This information is crucial for an accurate diagnosis and can help your healthcare provider order the right tests. Without this key detail, valley fever can easily be mistaken for bacterial pneumonia or another infection, which may lead to unnecessary antibiotics and a delay in proper treatment. Be proactive about your health. Share your travel history and any unusual symptoms with your healthcare provider. Don't hesitate to ask questions or request further testing if you're not getting better. Early recognition and communication with your doctor can lead to faster diagnosis and better outcomes, helping you recover more quickly. So, if you notice persistent symptoms after spending time in a high-risk area, don't ignore them. Speak up and get the care you need. Valley fever behaves differently in everyone. About 60% of people never feel sick. Their immune system quietly wins the battle. For most who do get symptoms, it's a flu-like illness that resolves on its own. But in 5–10% of cases, the infection becomes chronic, causing long-term lung problems. Chronic valley fever can lead to lung nodules, cavities, and persistent cough or chest pain. These cases often require long-term antifungal treatment. The severity depends on the number of spores inhaled, your health, age, and genetics. For some, it's a minor event. For others, a life-changing illness. Valley fever's unpredictability makes it a challenge for doctors and patients alike. Understanding your risk factors is essential. The journey with valley fever is unique for everyone. Subscribe, like, and share Cosmo Academia. In rare cases, about 1%, valley fever spreads beyond the lungs, becoming disseminated Coccidioidomycosis, the most dangerous form of the disease. The fungus can invade skin, bones, joints, and even the brain, causing meningitis. Symptoms include ulcers, bone pain, swelling, and severe headaches. Coccidioidal meningitis is life-threatening and requires lifelong antifungal treatment. Diagnosing disseminated disease can be difficult and often needs tissue biopsies. Treatment is long-term, sometimes lifelong, and medications can have serious side effects. Early diagnosis and treatment are critical, especially for high-risk individuals. Though rare, the severity of disseminated valley fever underscores the need for awareness. Take symptoms seriously if you're in a risk group. Most people with valley fever recover with rest and time. No medication needed. Supportive care includes rest, fluids, and over-the-counter pain relievers. For severe cases or high-risk patients, doctors prescribe antifungal medications like fluconazole or itraconazole. Treatment can last several months, and it's vital to complete the full course. Chronic or disseminated cases may require lifelong medication and sometimes intravenous drugs for the most severe infections. Surgery is rare but may be needed to remove damaged lung tissue or drain abscesses, always alongside antifungal therapy. Recovery can be slow, but with proper care, most people manage the infection well. Early treatment improves outcomes, especially for those at risk. Valley fever is serious, but with awareness and medical support, it can be managed. Subscribe, like, and share Cosmo Academia.